Hello friends, today we are going to talk about gynecomastia. What is gynecomastia? Gynecomastia is enlargement of breast in male. Friends, today we are going to talk about a condition known as gynecomastia. It means enlargement of breast in men or boys. This enlargement of breast tissue under the nipple in case of boy or man is because of imbalance in the hormonal activity in the body. If gynecomastia is because of overweight or excessive weight or obesity, it is known as pseudogynecomastia. In this condition, the enlargement of the breast is because of deposition of fat under the nipple area. Gynecomastia that occurs during puberty or when a person develops hormonal surge at the age of around 12 to 13 years of age, that kind of gynecomastia can go, if the gynecomastia develops, it can increase up to the level of hormonal activity is normal, that is around 18 years of age. This kind of gynecomastia may be reversible. Otherwise, most of the gynecomastia needs some kind of treatment. What are the symptoms of gynecomastia? Primarily, there is only one symptom. There is a swelling in the area of breast under the nipple, either on the one side or on both the sides. There may be some pain, there may be some tenderness, there may be some soreness, but main concern for the person who has developed gynecomastia is a psychological embarrassment, because whenever there is an event or incidence when one has to remove the shirt or t-shirt and become bare chested, the presence of gynecomastia causes lot of psychological embarrassment in the person. At times the person can go into kind of a depression also. What are the causes of gynecomastia? Now, what causes a gynecomastia? If we earlier talked about hormonal imbalance, and this kind of imbalance can happen during puberty, that is the developmental stage in case of boy. This kind of hormonal imbalance can also happen in case of people over 45-50 years of age, when the male hormone testosterone goes down and kind of circulating female hormone takes over. At that point of time also gynecomastia can develop. Otherwise, there is also an imbalance in the hormonal activity between this age group, that is anywhere between 18 years to 50 years of age, and whenever there is hormonal imbalance, gynecomastia can occur, because all men are having some amount of breast tissue under the nipple area, and this becomes overactive when there is hormonal imbalance. Apart from that, there may be some other causes of gynecomastia, or what we can say as a kind of a contributing factor, that is these factors increase the chances of having gynecomastia. Like these factors are excessive smoking, excessive consumption of alcohol, use of recreational drugs like heroin, MD, and sometimes when bodybuilders use a lot of steroids with or without the knowledge, gynecomastia can develop. About 10 to 25% of cases of gynecomastia are because of the use of certain medicines or drugs or such factors. Diagnosis of gynecomastia is mainly clinical, that is, it can be diagnosed with the help of clinical history as well as with the help of clinical examination. If we want some confirmation about the diagnosis, we may advise ultrasonography of the area to confirm that the swelling is actually breast or excessive fat tissue, whatever the case may be. Thank you. Depending on the size and extent of gynecomastia, it has been classified into various degrees, and an American classification actually puts it into 4 degrees. Grade 1 is just a simple breast gland enlargement underneath the nipple, or sometimes it is also called as puffy nipple. Grade 2 is enlargement little beyond that, but the level of the nipple is not pushing down or hanging down. In grade 3 gynecomastia, the enlargement is even more, and the nipple is lying at the level of inframammary crease. However, in grade 4 gynecomastia, it actually looks like a breast tissue with the nipple pointing downward beyond the inframammary crease, and these are the gynecomastia which are very severe and we do need treatment and the treatment may have to be modified in such cases. Treatment of gynecomastia consists of mainly the surgery, and there so far no medicine has been approved to treat the gynecomastia. Also, once the gynecomastia has developed, except in cases of pubertal gynecomastia, most of the time it does require surgical treatment. It will never go away on its own. Gynecomastia can be one-sided or two-sided, that is unilateral or bilateral. Whether it is unilateral or bilateral, treatment remains the same, that is the surgery. Removal of gynecomastia is done with the help of liposuction as well as removal of gland through an incision. Liposuction is carried out underneath the nipple areola complex as well as in the surrounding area where there is excessive fat deposition along with the gynecomastia tissue. The removal of gynecomastia tissue is carried out through an incision that is at the junction of nipple areola complex with the skin. It's a kind of half circle incision through which we approach the gland, excise it and remove it and take the sutures. Sutures are generally dissolving type. Operation is generally carried out under mild general anesthesia and a combination of local anesthesia along with. It's a daycare procedure, meaning thereby that the person can go home same day evening or after few hours. Post-operatively, gynecomastia does not require much of the care. At the time of surgery, you are given a dressing, that is kind of pressure dressing with the help of tapes. These tapes are removed at the end of 48 to 72 hours and then you are given to wear the jackets. Some surgeons prefer to give the jacket on the day of the surgery itself. Idea of giving jacket is to minimize the dead space, that is the space between the skin and underlying muscles, because we have removed tissues from between the skin and underlying muscles, so that the skin should stick back to the underlying muscles once again. Following the surgery of gynecomastia, you can resume your routine within 24 hours or after 24 hours at the most. You may be allowed to do all routine activity except heavy exercise and gymming, which will be allowed after 3 weeks. You need to wear the pressure jacket for at least 1 month, day in, day out, that is 24 hours a day. After that, you will be wearing it for about 12 hours a day for 3 to 4 months. Though the results of gynecomastia will be visible on the same day on operation table, and one can even see the amount of tissue that has been removed from under the skin, but the final result will take some time to be visualized, because there will be swelling under the skin as soon as the tissues are removed, and this swelling will take about at least a month to 1 month to about 3 months time to go, and then that will be the time to assess the result of gynecomastia. We are also asked by many people that will gynecomastia recur? The recurrence of gynecomastia is very rare and almost unheard of. However, if it recurs, it will not be again of the same magnitude, and if it bothers the person, then it can be removed with the same kind of surgery. What is high definition liposuction for gynecomastia? High definition liposuction uses ultrasound assisted liposuction or ultrasonic liposuction along with power assisted liposuction to remove the fat under the skin and to give a desired shape. One has developed its chest muscles, pecs as we call them, and these muscles are not visible because of the gynecomastia and because of the fat overlying it. So high definition treatment of gynecomastia will mean that we remove the excess fat covering the muscles with the help of ultrasound assisted liposuction and power assisted liposuction, so as to give a defined shape to the chest. This is high definition treatment of gynecomastia. People also ask me, can gynecomastia lead to cancer? Well, possibility of gynecomastia turning into a male breast cancer is very rare, and even when it is not removed, such a possibility is very rare only. So friends, this was all about gynecomastia. Do press the like button and do subscribe our channel for more informative videos. Thank you.